Lung cancer is, as the name implies, cancer of the lungs. It is the leading cause of cancer deaths worldwide. Usually the prognosis is poor unless the cancer is completely removed by surgery. Some risk factors for lung cancer are smoking, which is responsible for about 85% of lung cancer deaths, secondhand smoke, or exposure to chemicals like arsenic, asbestos, organic chemicals, radon, and uranium. Some signs and symptoms of lung cancer. In the early stages, they may be asymptomatic. They may also have chronic cough, hemoptysis or coughing up blood, wheezing, shortness of breath, aching chest pain, hoarseness, and dysphagia or difficulty swallowing. If they have pleural or peripheral lung cancer, signs and symptoms can include pain on inspiration, dyspnea. Sometimes they may have chest pain, pleural friction rub, pleural effusion, edema of the face or the hands from superior vena cava syndrome, fatigue, or clubbing of fingers. A few different tests can be done to help diagnose lung cancer. One, they could take tissue samples, take a sputum collection, use fiber optic bronchoscopy, percutaneous transthoracic needle biopsy, and an open excision. If they do an open excision, make sure to watch for severe bleeding and watch for midline shift of their trachea. Staging of lung cancer usually involves noting the tumor size, the nodule involvement, and then the distant mets, so using the T&M staging. They also may use a chest x-ray, a CT, MRI, or PET scan. They also may do blood tests for mets, and usually the mets go to the liver and the bone in lung cancer. Treatment of lung cancer is mostly like any other cancer: surgery, chemo, radiation. A couple surgeries can be done, are a lobectomy, which is a removal of a lobe of a lung, or a pneumectomy, which is a removal of a lung. So for this, make sure to have the patient lie on their back or their operative side to prevent leaking. Watch for tracheal deviation. Monitor their fluids and blood to avoid lung congestion, which they might manifest by shortness of breath, increasing crackles in the base of their lungs. And these patients may also need to decrease activity and exercise to prevent dyspnea, because they have a lower vital capacity now, because they only have one lung. Also, a thoracotomy may be done, which is an incision in the pleural cavity. Keep these patients, afterwards keep them in semi-Fowlers, have them cough and deep breathe every 1 hour, every hour for 24 hours, and then every 2 to 4 hours. And make sure to medicate them beforehand because it will be painful. Also treating pain. So pain relief for these patients is important. And doing arm exercises really for any type of lung surgery. Make sure they're doing arm exercises to prevent frozen shoulder. Other surgeries that can be done are segmental resection, which is kind of a way to remove the tumor, or a wedge resection, which is kind of where they remove a triangle wedge-shaped tissue, and usually it'll include tumor and some normal tissue. Radiation could be used post-op or for palliative care, and you may also receive chemotherapy. So complications post-op, if they do receive one of these surgeries, can include empyema, which is a collection of pus in the pleural cavity. They can get frozen shoulder, depending on the side that they had the operation on. So make sure that they are exercising, doing their arm exercises so that they can have their range of motion. They can also receive subcutaneous emphysema, which is leaking air from their chest tubes and through the incision into the soft tissue. Most of these surgeries, the patients are going to have chest tubes. So make sure to monitor their chest tubes closely and monitor for subcutaneous emphysema. Another complication can be pulmonary edema, bleeding, cardiac dysrhythmias, hypotension, and pulmonary embolus.